Hi, good evening. Steve Adler. Got a minute? We're going to go through some numbers. We're going to go through what happened today with the change in risk levels. If you're a regular watcher here, I've got a minute. Probably nothing that happened today was much of a surprise to you. But it may have been the first time that a lot of people in the community really took a look at the numbers and what's happening. But we're going to go through that here and take a look at some of that that we've been dealing with today. Let's take a look at the numbers. So on the first sheet that we have, and I'm pulling up something here that I'll need here in just a second. All right, so the numbers today, new admissions, 43. That's a pretty significant jump, 43. The 7-day moving average is 34. Look at the chart in the middle. You can see how the numbers are going up. You know what the modelers tell us is if we get to 7-day average of 50, that we're going to have to take some pretty drastic action in order to keep our hospital ICUs from getting overwhelmed. So we're going to continue to watch that 34. We all agreed, myself, Dr. Escott, Director Hayden, new county judge Andy Brown, that we needed to move to a higher risk level because we need people to get a little bit more disciplined, a little bit more focused. The goal here is twofold. One is to make sure that we stop our ICUs from getting overwhelmed. ICUs are overwhelmed right now in El Paso. We'll talk about that in a second. Doctors are having to make choices over which one of two people get care at the highest level. We don't want our doctors to be faced with that. We want everybody in our hospitals to be getting the highest possible quality care. We can't let our ICUs get overwhelmed for that. You see on TV healthcare workers around the country who are just in tears, frustrated and exhausted. We have to stop that from happening. But we have control over whether or not that happens. We can decide, as we need to do that, we're going to keep schools open here in Central Texas. We have it within our power to do that if we get serious about it. But anyhow, so the number today, new admissions, is 43. It was 32 yesterday, and that was real concerning. But 43 is a very concerning number. You know, it wasn't that long ago that our daily number was 4, and our 7-day moving average. This was right at the end of September. Same number here, 14. Daily 7-day average 4 cases we had that day. Going into October, we have numbers that showed us that we were at 13 as our 7-day running average. 12 admissions. That was into October. Look at the new case count, 45. Numbers of new cases that day. 7-day moving average 69. Number of people in our hospitals, ICUs, 26, 79 in our hospitals. That was just a few weeks back. These numbers change quickly. And when they change quickly, the numbers, once you change your behaviors, it takes 2 weeks for the change of behavior to actually start changing your numbers. That's why people get caught short. They expect when they change the behaviors, the numbers will start changing the next day, and that's not how this works. There's lead times. So anyhow, 43, 7-day moving average 34. We're going to watch that number every day. We'll talk about the risk levels in just a second. Number of new cases today. Remember what we just looked at? Number of new cases today, 290 new cases. 7-day moving average is 237. The challenge with having that many new cases, 290 today, is that some of those cases are going to end up in our hospitals, and some of those cases that end up in our hospitals are going to end up in our ICUs. And while fewer people who get the virus end up in our ICUs today as compared to April, because we know more about the virus today, we have better treatments today, still, if those numbers go up, the number of people in our hospitals and our ICUs are going to go up, regardless of what new treatments we have that are being made available in the state. 7-day moving average, those numbers in the green at the bottom. A number in our hospital, 7-day moving average 189, ICU 64, on ventilators 34. Let's look and see what the numbers exactly are tonight. Not the 7-day moving average, but the number of people actually in those positions. And you'll see that those numbers all exceed our 7-day running average. 7-day running average for hospitalizations, these are new admissions, is 189. The number of this is now the census, 189 people in our hospitals with COVID, 7-day moving average. Tonight, 213 people in our hospitals. So that 7-day moving average is going to continue to rise. Number in our ICUs tonight, 72. The number in our 7-day moving average, 64. So that number is going to continue to rise. 64 people in our ICUs right now. The number that we have without the overwhelming services is about 200 beds. Now we have more than 200 beds physically, but we only have staffing to support 200. We'll talk about that in a second when we talk about the risk chart. 37 people on ventilators in our hospitals tonight. The 7-day running average is 34. So all those 7-day moving numbers are going to be moving up. Number of people that have died so far, 473. We're getting close to 500. That number of deaths is going up in the state of Texas and around the country. 4 more people died in our city since yesterday, which means that we have 4 families today that are mourning the loss of a loved one. 4 more people probably that were unable to be with a member of their family when they died today because of the separation that we have in our hospitals. It was because we see those numbers rise that we get concerned. We looked at what was happening in other cities around the state, and let's take a look at the chart that shows us that. This is a chart that shows us what's happening in the major counties around the state. You can see the line to the right there. One of those counties has increases that are just off the charts. That's El Paso. That's where they're sending patients to other hospitals around the state. We have COVID patients in our hospitals from El Paso right now. We also have non-COVID patients from West Texas in our hospitals now because there was no space for them for non-COVID stuff in their hospitals. They're just off the charts and know that they're dealing with this now better than they might have otherwise because the state was able to send 1,000 healthcare workers, healthcare professionals to augment what El Paso had. That's the only way that they're being able to cope, even at the levels that they're indicating right now, is with that state help. We have other cities where the numbers are also rising pretty extreme. That blue line right under El Paso is Lubbock, where it's rising. The number is right below that. That yellow line is Harris County, where the numbers are starting to go up. Also going up are those the green and the orange line. That's Dallas and Tarrant County. If you get picked up by EMS right now, they don't rush you to the hospital in their downtown urban areas. They take you, the EMS goes a farther distance away to take you to a hospital that has more space. That has not happened to us yet. The state, the governor is sending additional healthcare workers up to Dallas and to Fort Worth to help. The problem is that you take a look at those last 2 lines down at the bottom. That's Bexar County is the light blue line. The dark blue line all the way at the bottom is us here in Travis County. The problem is that if Tarrant and Dallas numbers continue to go the way they're going, if Harris County numbers continue to go up, the governor's not going to have enough healthcare workers to keep sending to us. These other counties the same way that they're being sent out to Amarillo and Lubbock and El Paso right now. There just are not enough people. They will run out of people before they get to us. So we know that we're likely going to be on our own, not able to bring in additional help to help us surge. We're just going to have to depend on the ICU space we have right now and on the professionals, the healthcare professionals that we have right now to tell us how much capacity we have. So let's take a look at the risk chart. This is a chart you've seen for a while, but this has been modified, and this is how this chart's been modified. We know when we started this process back in April as we were going into June, that we had about 340 ICU beds that were available for COVID. Now, that's not all of our ICU beds, because even while we have COVID, we have people that have heart attacks. We have people that need intensive care units to get into accidents. So there's a certain number of beds that we have to keep available for that kind of patient as well. But we had 340 beds that we thought, from a planning perspective, we would have available for folks with COVID. But in order to get to those 340 beds, we knew that we would have to surge, which means we would rely on services that provide temporary workers. We would reach out to other parts of the state to help us bring in those workers. That's how we surged to get to that space. And we used that 340 number thinking that would be our capacity. So we would know where to cut off as we were getting closer to that number to make sure we didn't exceed 340. But what we learned in June, and we're trying to learn as we go through, is that the cavalry of healthcare workers is not coming over the hill when it gets to us, because there are just too few of those extra workers. And when it's getting to us, the demand around the state is just way too great. So we realized that we have to do our planning based on 200 available ICU beds, and we have now revised the charts. You can see the levels that we've had here traditionally: green, blue. Boy, I tell you, we were so close to blue. That's lower than 10. We had gotten to 12. We were so close to getting there. We can get back there again. We were in yellow for several months here. For a period of time. That was a kind of a comfortable place for us to be. Not perfect place, but certainly better than where we are right now. We were able to hold that. But the rule, as we look at it now, is that as we go above 30, used to be 40, but now we're taking it down to 30 because we know we don't have 340 ICU beds. We only have 200 available to us. That's 30. And when we got up to 32 yesterday, that meant we crossed that line. Dr. Eckhart looked at the experience in El Paso and Lubbock. He looked at what was happening in Dallas and Fort Worth and in Harris County. We talked to the modelers at the University of Texas to see what we should expect. They look at the trends, and we'll get to some of their numbers here in just a second. They also look at mobility information that is anonymized in our city. We also know that we're heading into Thanksgiving, and there's an urge for people to gather inside in our homes with an extended family or extended group of friends, which we're advising folks not to do. We'll talk about that in a second. We have to figure that that's going to happen in some places, and we have the potential for a peak. We also have students now that are coming back to our city from universities across the country, many places where the positivity rate is higher than it is in Austin. All these things coming back to our city, happening all at the same time, we needed to move up a risk level. So we have moved from yellow to orange, and in that orange area, we're moving to orange right now because we recognize that at this point in time, we have the ability to stop our city from having to go into red. Nobody wants to go into red. Nobody wants to shut down and have a really defined stay at home where you can only go out for essential purposes and you can only get food from curbs and you couldn't sit down at a table outside. even just with your immediate family. No one wants to go to that place. Well, we have it within our control to avoid that. No one wants to close schools. We have it within our control to make sure that that happens. So at this point, we should be spending all of our time and our energy now enforcing the rules that we have, and we're gonna re-emphasize and re-up enforcement in our city, both with respect to restaurants and bars that are filling up. When I say bars, it's the bars that are operating as restaurants under the governor's loophole that he created. We're going to enforce our rules better in those places, more stringently in those places. But they're also going to be taking a look to make sure that when we're outside around other people that we're wearing masks and we're social distancing. We're also going to ask for some behavior changes. We're going to do everything we can to try to preserve the opening of schools for our children and the opening of businesses that we have now. We have it within our control to not go down to red, to stop that 7-day average from going over 50. And that's what our community should be focused on right now. So we're moved into the orange area. Moving into the orange area means that everybody really needs to think about the number of interactions they have over the course of the day. How many times are you with people, other than people you live with in your home? Are you with people where you are within 6 feet of those other people, where you have close contacts, those close interactions? I know, of course, every one of you is wearing a mask whenever that happens, but even in that close distance, think about how many interactions you have a day. And going into orange now means we need to minimize all of those interactions as much as we possibly can. If you go out to a restaurant to get a non-home cooked meal, eat outside, and go to that restaurant with people that are in your family that you live with. Don't use going out to a restaurant to be with 2, 3 people this day, another 4 or 5 people the next day, another 3, 4, 5 people the day after that. We're trying to limit the number of physical interactions we have at this point. We're asking restaurants and the bars operating as restaurants to voluntarily take their occupancy levels down from the 75% that the governor's order allows and go to 25% to 50%. Let's space people out more. The best way to ensure that we don't go to red and then have an order where we have to shut down things completely is to ratchet down, show a little bit more discipline where we are right now. Now, when we're doing this is we're doing this from a voluntary basis. If you are a high-risk individual, if you're over 65, or if you have diabetes, or if you have one of these pre-existing kinds of conditions, if you're a high-risk individual, under this orange area, we're suggesting that you don't go out at all unless it's really essential, and that you're not around any more than 2 people in a gathering, not the 10 people that it is for the rest of us. If you're in that susceptible group, you have to be especially careful right now. And your family needs to be especially careful right now to help protect you and not bring virus back home to you. We have to be especially careful. A lot of the things we're asking for now are voluntary because they go beyond what the governor's order allows. And I say 2 things about that. The first is, just because you can legally do something doesn't mean you have to do it. And as a community here in Austin, if we're trying to protect our schools and trying to keep our businesses open as best we possibly can, let's go beyond what it is that the governor's orders would allow to provide one another greater and greater protection. You know, the question has risen with respect to, can we actually order things that go beyond the governor's order? Of course, the governor says no. I continue to believe that we can. Just like the judge in El Paso issued an order that you saw their numbers, was trying to get a handle on that, putting a curfew in the evening, things that make abundant sense and that are supported by the community in El Paso. He had that order put into place. The Attorney General took him to court, and by a 2-to-1 vote, the Court of Appeals ruled in the Attorney General's favor. But I read the opinion by that other judge, the 2-1, that one judge. And what he said made perfect sense to me about local communities having the power under our laws and constitution to be able to have a community decide what is best for that community. And I think we have that power here. My hope is we never have to test it that way. My hope is that if our numbers continue to rise, then the governor's going to do what it takes to save lives in our community. And we can deal with that later when if we ever get to that place. But know that we don't have to get to that place. We're going to do an even better, more stringent job of enforcing, and we can, by our behaviors and our conduct, lower this number if it's important enough for us to do that. If we really, really want to rally as a community, we can do it. We've already done it twice. We did it in April, we did it in June going into July, and we can do it again. And now's the time we need to do it, especially as we're moving into Thanksgiving. Let me show you what this chart means in terms of the modeling as we go into the future. There are two charts I want you to see. This is a chart that shows you the number of patients that we have in our ICUs. And if you look at the dark numbers that are on the left-hand side of this tells you exactly the number that we have. Those are the black dots. You can see that we got almost up to 200 during July. And remember that we only had the capacity for 200 before we overrun our ICUs. We never got up to 200. You can say we stayed below that, but look how close we got in early July to having our ICUs overrun. But we did well as a community. We identified the triggers in time. We got the community involved, and people did what they needed to do based on the triggers when we announced them, and we were able to stop it. Well, you can see the numbers came back down, and the number of our ICUs got really low during the period of time of September. But then in October, our numbers started going back up again. The black dots tell you where we are. If we don't change things, if we continue with the same behaviors we have, Lauren Myers, Dr. Myers at the University of Texas, and her modeling folks tell us what is the scenarios, when you look at all the scenarios that represent the mean of the possible future outcomes. If we don't change our behaviors, it's the green line. And the mean green line gets to a number that's over 400. It's possible that we could get to a number that is above 600. At the very least, it looks like under any scenario, we have a number that's well above 200 and almost to 300. That's the green line and the green shading. If we don't do anything, we're pretty much guaranteed that we're going to overrun our ICUs in the city. So we have to change our behaviors. The next line is that orange line that you see. And the orange line, you can see the median line, it's the dark line, and you can see all the scenarios that are kind of in that orange shaded area. And you can see that if we stay in that orange shaded area, we pretty much stay below 200. We go right above it there initially, maybe in mid to late December, but pretty much we stay below 200, and that's under any scenario. The most likely scenario, the mean scenario, if we change our behaviors, have us not really going that much above 100 in our ICUs. Remember that our number right now in our ICUs is in the 60s. If we change our behaviors, do what the orange conduct is, then we'll stay below 100. You can also see what happens if we go to red. We go to red, we just shut this thing down. And that's why we know and are comfortable asking people to go to orange. But if that doesn't work and the hospitalizations, daily hospitalizations get above 50, then we have to contemplate going to that red line kind of behavior, which none of us want to do. And we have control. We have the power to prevent that from happening in our community. And that's what we all need to be focused on now. But those are the total number of hospitalizations. If you go to the next chart is just the number of daily admissions in the hospitals. It looks like the other chart, but this is what we use to key off of for the trigger. That's how we get the 50. You can see that we're right below 50 right now. You saw that we're like at 32. And we just have to keep that number from going above 50 so that we don't hit the trigger. I want to again urge everybody as you come up to Thanksgiving to start making plans right now. It is suggested by the CDC nationally, as well as Dr. Escott, Director Hayden, County Judge Andy Brown, myself. This would be a good Thanksgiving, really, just to celebrate it at home with the family that we live with. Zoom with your extended family. Zoom with your friends. If you want to bake something and cook something for them, that'd be a great thing to do too. But then you should take it over to their house, leave it at their door, knock on the door, ring the doorbell, let them know it's there, and let them pick it up. We really do want to try to minimize the social interactions as much as we can. Most of the cases that we're seeing in our city right now are happening in the evenings in these social events. It's because when we get together with our extended family members, we get together with our friends, we relax. We don't wear our masks because these are our friends. And surely our friends wouldn't be carrying the virus, except that they're just as likely to be carrying the virus as somebody else. And at this point, we have to assume, we have to act as if everybody we run into may have the virus, which is why we have to wear masking, except for the people that you're living with in your home. Again, high-risk individuals should stay home as much as possible. And if you have someone over 65 living with you, or somebody that is susceptible, please do everything you can to protect them. Absolutely, the most you possibly can. Those are the folks that are most susceptible, and they're dependent on everybody around them to try to help keep them safe. If you go out to a restaurant, best to eat outside, best to go and eat with the people that you live with in your home. Minimize the number of additional people that we have physical contact with. Again, we've done this before. We can do it again. As you come up to the holidays, don't take a risk with just one holiday that could put in jeopardy years worth of holidays with your family hereafter. We are so close to a vaccine right now. You can almost touch it and taste it and feel it. We don't have to do this kind of thing much longer, but for a little bit longer, we need to. The mayor of San Antonio, Ron Nirenberg, said the other day that a social life is important, but it's not as important as an actual one. And I think that that's true. Just for a little bit longer, we need to hang on. And for right now, we need to do a better job than we've been doing. We need to be more disciplined. We need to stay at home more. We need to be more vigilant. We need to decrease our interactions. You saw the charts. We have it within our control to keep schools open, keep businesses open, but only if we change our behaviors. Please do that. Please start planning your Thanksgiving around that. And with that, y'all take care and have a good evening and be safe.